Hey guys, it's Dave. Today we're going to discuss hypertension or high blood pressure in the different races and the aspects you need to look at, because unfortunately the majority of drug studies that have been done through the years were based on white patients or European patients, so there's not a lot out there on different races. Just within the last 10 years, we've started to see a lot more studies being done with African Americans and Hispanics and Asians, but there still isn't quite the population base there that you really need to look at to really know how that's going to affect you if you're from one of those races, or even Middle Easterners. And there definitely is going to be different side effects and different effects, period, on how well you respond, because we've seen that different genetics can affect how you metabolize and how you respond to different medications. So we will look at a couple of the different races I was able to find. The first major one for African Americans. For you tend to develop hypertension earlier in life, and your blood pressures do range to be higher. Even normal blood pressure can range to be higher than people of other races. For treatment, you want to be looking at a thiazide diuretic or a water pill, things like hydrochlorothiazide, indapamide, chlorthalidone. Those are the main ones you look at there. A calcium channel blocker, just some examples there would be amlodipine, verapamil. Hydralazine is another good drug of choice that has really done quite well to lower blood pressure in African Americans. As far as beta blockers, you don't really respond well to beta blockers. However, if you have heart failure, you need to be on a beta blocker. Propranolol has shown to be one of the better ones giving you results. ACE inhibitors, drugs like lisinopril, ramipril, captopril, do not do as good for you. ARBs, or angiotensin receptor blockers, do not do as well for you, and in fact they can actually do more harm than good in a lot of situations. Those are drugs like telmisartan, losartan, olmesartan. Okay, with you have a lower cardiac output, higher peripheral resistance, and a lower renin state, which actually can cause the differences that we're seeing why you may not respond to ACE inhibitors as well as other races respond to it. So that's the different makeup and why you respond to that well. As far as Asian Americans, one of the first things that you need to look at is reducing your salt intake. Because of your genetic makeup, that is a huge thing, along with your diet, because for a lot of Asians, you have a high salt intake, period, with a normal Asian diet. So reducing that salt intake will help you out. Calcium channel blockers, like I said, verapamil and amlodipine, are a good first choice, along with diuretics in general. Water pills like hydrochlorothiazide, like I said, chlorthalidone, indapamide, or furosemide, which is a loop diuretic. ACE inhibitors like lisinopril, captopril, drugs like ramipril in that class do quite well with you, as well as ARBs like losartan, telmisartan, and olmesartan. Those will all give you good benefits with that. But your first priority is to lower your salt intake. For Hispanics, you guys are lucky. Your blood pressure tends to run lower than other races across the board, and your cardiovascular mortality is lower than other races across the board. Does it mean you get to be scot-free and get off with everything? No, it doesn't. You still need to exercise. You still need to watch what you eat, watch your weight. But your genetic makeup is saying that your blood pressure is going to be lower than everybody else, and your mortality rate from cardiac disease is going to be lower. So that's a bonus. As far as drug choices, ACE inhibitors are a good drug choice. Calcium channel blockers are a good drug choice, along with diuretics. And for you, if you have diabetic family history, a combination of an ACE inhibitor, a calcium channel blocker, and a beta blocker can lower your risk of getting diabetes or lower your risk of making your diabetes worse. And if you're looking at a calcium channel blocker, Verapamil is the one you want to look at. So that's your best choices there. The last one that I want to cover, and by all means, I have not covered everyone out there. And if you have a mixed descent, some of this can apply to you, some may not. You can do genetic testing to see how well you are responding to medications you're on. But for Native Americans, you want to pay specific attention to your blood pressure and your heart risk, because cardiovascular disease is actually the #1 killer in Native Americans. And honestly, it's #1 across all Americans as a whole, but with Native Americans, it is the #1 killer. But 36% of all Native Americans with cardiovascular disease will die by the age of 65. So you need to take it more seriously. Do things like exercise, quit smoking, watch what you're eating, and stay compliant with taking your heart and your blood pressure medications. Now, for you, ACE inhibitors are a good choice. So again, the drugs like captopril, lisinopril, ramipril, that is a good choice. Benazepril is another one I didn't mention. Diuretics, water pills like furosemide in that class is a good choice, along with the calcium channel blockers and beta blockers you respond to as well. Make sure if you have any heart disease or heart issues, you talk to your provider about being put on a beta blocker, because that will help lower your heart rate as well as your blood pressure, where cardiovascular disease is so prevalent and is the #1 killer within your community. You want to make sure you do all you can do to take care of yourself.